In this video, we're going to cover the functional anatomy of the shoulder. We're going to talk about the shoulder joint, the three major bones, and we're going to talk about the important muscles that I usually end up treating in the clinic, their functional relevance, their biomechanics. So the shoulder joint's interesting as it's this long limb that attaches to your thorax. There's only three major bones. You have your scapula, which is on the back and glides in your thorax. You have your humerus, which is your upper arm bone, and then your clavicle. Now, the most interesting thing I find about the shoulder is that the only bony attachment for your whole arm to your thorax is this little clavicle bone. So your clavicle attaches right here at the Sterno-clavicular joint and then makes an attachment at the acromion, so part of the scapula. And basically all the clavicle does is provide this little pivoting spot for the scapula and the shoulder blade to move around. All of the other arm functions and stability and strength is all from muscles, which makes the shoulder joint very interesting and cool, but can also be a little daunting to treat. Now, the rotator cuff is something you probably have heard of before, and it is four key muscles. So if you have your humerus, and then your rotator cuff is four muscles, in the back you have two. You have your Teres minor and your infraspinatus. On top, you have one, the supraspinatus, and then in the front you have your subscapularis. Now, looking at it on the anatomy, the subscapularis is on the front fossa of the scapula. The infraspinatus is on the back. The Teres minor comes off on the lower border. Your supraspinatus is in the gully. So they're all coming off of the scapula there. Now, the function of the rotator cuff is to, yes, rotate the arm in different positions, but its primary function is to actually depress the humerus into the fossa of the scapula. So basically, these four muscles insert onto the humerus and pull the humerus down into the glenoid fossa, keeping it stable. Now, why does it need to pull it down? Our deltoid muscles sit from on top of our shoulders onto and attach down halfway through the humerus. Now, that has an upward vector, and our deltoid is pretty strong. We have our front delt, middle delt, and posterior delt, all attaching in the deltoid tuberosity, pulling up on the arm bone. So the depressor cuff, or the rotator cuff, inserts on and helps to hold it into the socket in place there. There, of course, is other muscles in play there, but that's just simplicity of that. Other important muscles that we need to be aware of that influence the shoulder joint and the mechanics are our pec minor and major. Pec minor inserts into the coracoid process right here. Our biceps short head also inserts in the coracoid process, so that has an influence on how our scapula and shoulder moves. Our pec major inserts onto the lip of the bicipital groove, and our lats also insert onto the medial lip of the bicipital grooves. We have our biceps long head tendon, which runs up and inserts into the actual joint of the shoulder. So those are other key muscles that we need to be aware of when treating and looking at the function of the shoulder, as they have attachments that influence the arm and the mechanics of everything. So again, the shoulder is really just two joints. You have where your humerus is into your scapula at the glenoid fossa, making up your glenohumeral joint, and you have where your clavicle is attached to the acromion, making up your AC joint. This is often the joint that gets injured when people land on their shoulder, and then your glenohumeral joint is when you get subluxations, dislocations, injuries to the rotator cuff, overuse injuries, that sort of thing. Now, there's other interscapular muscles that really influence how well our shoulder moves. So we have our upper traps, and we have our mid traps, and our lower fibers of traps. This creates a diamond-shaped muscle on our back that is really important for our overall function of the scapula when it's rotating. We also have our rhomboids, which are in between the shoulder blades attaching to our thorax. These muscles really help with the retraction, and our serratus anterior, which is also really important for how our shoulder upwardly rotates, attaching from our thorax to the little inferior angle of the scapula. So all of these muscles work together to try and create our fluid scapular thoracic rhythm. So how well our arm rotates and how well our scapula glides on our thorax without causing pain or dysfunction. In my next video, I'm going to go into more detail about some of the common injuries that I see in the shoulder and how I treat them with different exercises and other things. Thanks for watching. Please like and subscribe and leave a comment below of something that you'd be interested to see next. Tune in next time.